oil. You can use moisturizing shampoos, conditioners. That can help to treat a dry scalp. There's also anti-dandruff shampoos like ketoconazole, Perthione zinc. That can help as well. Ketoconazole, there's a over-the-counter and prescription strain. May also help to thicken your hair a little bit. But if it's not helping and you still have dry scalp, dandruff after a week or two, maybe best to see your physician as well.
Okay.
So, Doc, what if you start to see a little bit more hair in the shower drain than usual? This seasonal shedding, what are the causes of that?
Yeah, so seasonal shedding does happen. No need to worry, no need to stress out even more because stress causes and can cause some shedding of hair. As you're going from the summer into fall and winter, you go through hormonal changes, there's less sunlight, less vitamin D, that can trigger a little bit more of a shedding.
This is we're talking men and women here.
Men and women,
Okay.
exactly. But the good thing to remember is that hair does come back in. It's not a permanent loss of hair. Also, it's good to have a good diet and to eat well because deficiencies in fatty acids, vitamins, protein can also trigger a little bit more shedding as well.
All right, let's move on down one more and talk a little bit about the different seasons of hair cycle phases.
Yeah, so this is something everyone goes through as well. So your hair follicle cycles. There's an anagen or a growth phase of the hair cycle, which most of your hair is in this cycle at any point in time. But that transitions into what's called a catagen or transition phase where it actually starts to begin the shedding process where it separates. The telogen, which is a resting phase, and then exogen phase, which your hair sheds. So every hair follicle goes through this cycle over your lifespan, and it's normal. Your hair will shed. You may notice hair in the shower, hair in your brush. People shed 50 to 100 hairs a day. That's normal.
Oh, wow.
Yeah.
Every day.
Every
That's a
day.
lot.
No matter
Every
the
day.
season.
Okay, I have a
That's
good
right.
one. I think this is a hot topic. Well, I know
Yeah.
it's a hot topic. Let's talk about eyebrows. First of all, on TikTok, they have this whole thing called eyebrow blindness, which I had never heard of. But sometimes you overpluck, and then you don't know if you can grow them back, quite frankly. So can you? grow them back?
Yeah, the answer is yes.
Yes?
And it is huge. We're seeing a lot of people coming in concerned with their eyebrows. People have been over tweezing, over plucking
over
for
years.
years. Their eyebrows just thin out. So there are some treatments.
Easier than for your scalp? Do eyebrows come back easier?
Eyebrows, it may be similar,
Okay.
but there's treatments and procedures that can be done. So there's over-the-counter topical minoxidil, bimatoprost is a prescription. These are treatments that are off-label for eyebrows. They're not technically approved for eyebrow use, but studies have shown that they can help. So it's best you can try that. Best to be under a physician's supervision.
Put it right on over in that spot?
With a Q-tip, gently put it on. But I would speak to your physician first before using it. And also eyebrow transplants. And it does exist.
Where do you take the hair from?
We take the hair from the back of your head and we transplant it exactly as your hair naturally grows in your eyebrows. And it grows. You have to trim a little bit more frequently, but it looks completely natural. Makes a huge difference.
I
People are
actually know
super
someone
happy.
who has it, and it's good.
Yeah.
Wait, really quickly,
They're
because
really
I know people
happy.
care about this. I've heard castor oil and rosemary oil. Does that really work?
So a lot of people use it. It's been trending. There's not really great evidence that it really makes a difference. It can be irritating as well. So you got to be careful if you're going to do it. And there's not great evidence behind it, but it's something that has been trending.
I have learned more about eyebrows in the last 3
staring
minutes.
at everyone's eyebrows. I'm like, nice.
That's
Nice.
right.
The pencil. I can just take it from back here and put it up here. Dr. Wilfeld, thank you so much.
Thank you very much for having me.
Okay, coming up, a tail wagging edition of our series, The Upside.